Well, I'm Dr. Lekeleji Temi. I'm the MAE Research Coordinator here at LMDC. Okay, currently we have 203 Liberian doctors, and we have 95 foreign doctors, making it a total of 298 doctors and dentists. Currently, if we take our population of estimated 4.5 million with 298 doctors, we'll be talking about a doctor ratio of like 1 to 15,000. Okay, and if you look at the WHO recommendation, which encourages countries to have a doctor ratio of 1 to 1,000, you see that disparity. There's a very wide gap of doctor to patient ratio, making it very difficult for the access to doctors by our citizens. Certainly, I'll say that the lack of doctors is a serious issue here in Liberia, especially our high mortality, maternal mortality rates. And over the year, we've been trying to reduce this. And if you don't have the qualified people to be available for emergency, especially emergency obstetric care, you don't have the people, the trained manpower to deal with emergencies in different areas. It's difficult. It's really difficult for people to go on living without these assurances, because if somebody has a psychological problem and you don't have a psychiatrist to help you, some of these things can be killed. Some of these things can be worked out. Some of these people can go to rehab, and then with the appropriate treatment, they can recover. Okay, if you don't have the pathologist to serve the population adequately, so that the different kind of cancers can be detected in individuals who need these services, it's difficult, because somebody will just go in and out of the hospital, not having access to a doctor or a specialist who's going to be responsible for this kind of care. And a person might just, that's the reason why in our African setting they say, oh, the person was well and it just died. Suddenly somebody just got up from bed and just died. There are a lot of medical explanations. Okay, people even die, and then there's no forensic pathologist in the country to come up with the evidence for why this person died. Those kind of issues. Well, I would say every medical facility is not fully staffed when it comes to doctor. Okay, the Ministry of Health currently has a projection to have specialist care at our local facilities, at our county and facilities around the country. They also intend to establish regional health facilities that will cater to specialist needs of our people, and it could also serve as a means of strengthening the referral system. So, for example, you have a county hospital, an entire county, and then you have 2 doctors or 1 doctor. So it's a difficult thing. So if that plan can actually be implemented within a short period of time, we can be assured of specialist care at a decentralized level for our people to benefit from. That's a very difficult question, but if I lean on the side of our mobility and mortalities, the highest mobilities that we have and mortality, they lean more to emergency obstetric care. So for me individually, I would advocate for more obstetricians and gynecologists, and I'll also opt for more internists, pediatricians, um, and also some of those areas that are completely lacking. At least we have a dermatologist, a veterinarian doctor, but we could also have an oncologist, a cardiologist. These are people who are very vital in the referral system and in as regards specialist care. So usually people have urological problems. They have to be flown out of here to Ghana or Kenya or some other place in the world where they have these services. So it's a huge burden on our people, okay? And we haven't done that amount of research to ascertain the amount of the disease burden, especially when it comes to cardiovascular diseases, when it comes to urological diseases. We haven't done significant research to get the figures, okay, of what the disease burden is like in these areas. So and then people die. The rate of hypertension increases. I mean, it's widespread diabetes. So we need specialists to really help in this, and we need more generalists to be populated in our health facilities around the country to help our people. Well, you're talking of incentives. I think our government is doing what is capable of doing right now, but there are serious issues when it comes to getting a doctor to even go to a remote area. Okay, the doctor lives in Maserado. He has his family here, and he all of a sudden has to relocate to Grand Crew. The first thing is a big challenge to even get to Grand Crew. The next thing is what are the infrastructure available in Grand Crew to make this doctor efficient. So we basically have a lot of challenges, and we hope that our economy will improve over the year, so that we can be able to afford that encouragement package for doctors to be able to be assigned in these remote areas without any problem. It's a sad situation. It's extremely sad. Uh, the only pathologist currently in the country is an Ethiopian and works with the Jackson F. Doe Hospital in Tapeta, Nima County. It's about um, roughly 7 hours from Maserado in a vehicle, and it's a challenge. You're sick. You're sick. You have a condition. Maybe somebody has, or a physician has diagnosed as cancer, and then you want confirmation of this diagnosis. So the only place you have to go is approximately 7 hours away in a vehicle and not on a very good road. This is a challenge. You're sick, you're extremely ill. Some of them in very bad conditions, and they have to travel this kind of distance. The distance might even kill you before you even be able to access this care. I mean, this service. So it's a huge issue. It's a very serious issue. So you don't know what kind of conditions you have. You just don't know, because you don't have the specialist to diagnose and to confirm these conditions. Okay. Last year, 2015, we have an estimated 35 graduates who are currently on the internship program distributed around the country, and they'll pretty soon be joining the workforce. And basically, okay, if I do a little analysis of how many students graduated for the past 2 3 years, for example, 2013, 38 persons graduated, and then 2014 we didn't have a graduation because of the Ebola crisis, and then 2015 35, and then uh, 2016, the current class, the current fifth year class, they're 42 in number. So if I just estimate 35 persons graduating per year, uh, let's take, for example, we have 60 students enrolled, and then we have usually a high attrition rate, and we graduate 35 per year for the next 10 years. We're looking at pretty close to 350 doctors, generalists. Well, the LMDC, like any agency of government, has huge challenges. Okay, uh, we're a new institution. Okay, the first thing is the challenge of getting our people, our citizens, aware that there is a channel, or they have rights as patients. Okay, and then getting our health workers aware that they have a responsibility. Okay, they have to live up to the code of ethics. Okay, um, so that because they owe it to our people, they owe the professional services to our people, and then the health facilities also um, owe quality service provision to our people. So if we are able to get this message across to these, to all the different players, is going to be a very big achievement. So currently we have an issue with individuals, common people, knowing their rights. If they go to the facility, how they're supposed to be talked to. A lot of people still do not know uh, whether they're supposed to go and ask a doctor, say for example, do you have a current license to practice medicine? You know, those kind of issues. And next we have a proliferation of private facilities, and most of these private facilities do not have any form of support. They depend on remunerations they generate from patient intake, uh, and then they mostly do not follow protocols. They do not have the supportive supervision because they're not within the public health sector. Even though the Ministry of Health tries very hard to incorporate the private health facilities into these kind of activities, but there is still a serious challenge with performance, with the maintenance of the upholding of standards for the professional practice of medicine in this country. And there's a huge support issue when it comes to LMDC. We have an issue of capacity, okay, human resource capacity, logistics, and we're not decentralized to that extent. So, for example, we have only one station which is located in Bon County currently, that deals with issues of regulatory issues for Bong, Nima, and Lofa. And the rest of the country is still not covered extensively. Okay, So we're currently working on a lot of issues, and the Ministry of Health, the health sector, has taken key interest in our role, and because of this, we're making tremendous strides towards improving these kind of services. So we'll be able to reach out to these facilities, inspect these clinics, see to it that they are actually doing what they got their accreditation to do. Okay. We also have issues with, as LMDC, on compliance. For example, somebody who is stationed in Rangida or in Maryland or Nima and comes to Maserati just once in a year's time. What's that mechanism to enable this person commit themselves to relicensure? So these are issues. Currently, we have 71 of the 298 doctors, we're talking about July, that have come to the council to renew their licenses. So we reach out to these people, we go out to them, we encourage them, but there are still issues. There's still issues. I'm not trying to defend them for not being compliant with relicensure, the process of relicensure. We also notice that there's not much that is being done currently for our healthcare workers, especially doctors and dentists, in line of improving their practice over the period. So we're trying to work on some issues that has to do with continuous professional development, so that if you're an internist, you don't just practice without indicating at the period of your relicensure that you have gone through series of trainings and you've accumulated some level of CPD scores that will qualify you. So this is something we want to institute. We think it's going to go a long way in reminding our physicians on the need to be current with changes in the medical profession. And also, some of the challenge would be, one of the major challenge, I'll say, we don't have an office of our own. This is something that is the case with a lot of institutions around the country. So, for example, the nursing board is far away from here. The pharmacy board is somewhere, some part of Maserati, and then you have the LMDC here in an office that might not even be adequate to actually accommodate the staffing needs that we project in the next few years.
I choose to come to Liberia because when I finished my medical school, after internship, I was doing second job, but I didn't find a main one. So, and one day in the radio, I listened to the radio. They said that they were looking for medical doctors in Liberia. It was just when Liberia was coming out of the war. I think in 2009. And I went to Liberia Embassy in Congo. And the ambassador confirmed the information. We were something like 5. And he helped us to get documents, everything. How we came, we were 5. But for now, I think I stay the only one here now. I went in Liberia on September 2009. My colleagues, there are some that left after 2 years, and the last one left after during Ebola crisis. I read first about Liberia. And I saw that in Liberia people, they are almost like Congolese people too. And when I came here, only the difference was only the language, English. Sometimes I used to forget that I am in English country. Sometimes I want to speak French, but because the same faces, so the same people, it's just the language, the difference. Not really challenges, just as any professional, any doctor. The challenge any doctor can find in professional, but not especially because I'm foreigner. No difference. Because when you're on this field, medical field, you don't get no nationality, no woman, no man, so you can work anywhere. So I feel comfortable. Working together. Sometimes the patient can be too much just because not enough doctors. So you see the patient too much. When you go home at the end of the work, you are tired because the workload too much. So if some doctors can join us too, it will be fine. Maternity, we have 2, pediatrics 1, internal medicine 2, and the surgery 2. So something like 6 in my department. I'm the only one. They consider that the workload. And when the workload too much, there are some patients you cannot really focus on because the workload is too much. As long as I feel comfortable, I'll tell them that medical doctor professional is universal. So anywhere you can do your professional as the teacher, and you will feel comfortable.